exercise to increase your diadokinetic rate, on this to get to all that. So now we have 1 minute for you to vote again. And so once again, now to see if there's been any persuasive effect of those presentations, if you would raise your hand if you agree with the proposition that indeed accreditation hinders innovation. Your recorders will. Okay. All the recorders got it? Now vote in the opposition that accreditation does not inhibit.
Just for the discussion,
Okay.
She's here to get that, so you can get that.
What if you wanted to what? There's a good, yeah. There's a good reason that Robert's Rules of Order has changed to have no other, any no vote, not voting in the process, because that obviously is a, oh, I'm sorry. There's a negative vote. In any case, so we have 5 minutes for some discussion on the topics, and yes, sir. An immediate.
I know. Karen, I was struck by your worst, boy, that was a Freudian slip, use of the term responsible innovation. And so what do you mean by responsible innovation? I have a vested interest in your answer here, but I'd love to hear what your thoughts are.
Responsible innovation is, I think, starting to look at how do we have the best practice evidence to support the innovations that we have. There are certainly a range of innovations that are not necessarily, someone gets a good idea, and I think we need to think before we really integrate in the kind of untested innovations that don't have a well-balanced base of support. At the same time, I think we need some flexibility to have some laboratories to try some new ideas. And that in the process, as I mentioned, of implementing such innovations, it's how important it is to really look at the evaluative aspects of innovation so that we don't do widespread replication before we really have tested them.
Yeah, I have really a question about the speed with which criteria can change. In general, they're fairly long intervals before criteria get reviewed, and there's a long, lengthy process that usually takes several years. And so really my question is, do you think we're able to move quickly enough for accreditation to support innovation in a rapidly changing environment?
Yeah, either one.
Okay. I think you raise a very important point. The challenge, I think, is to provide enough flexibility in the standards and sufficiently less prescriptive emphasis on some of the structures and processes to, in fact, assure that that time constraint is less the barrier than, and I think that's really essentially where it rests.
Yes, sir.
Yeah, Roger Strasser, Northern Ontario School of Medicine, Canada. I voted against the proposition and based on my own experience, but I was really impressed by the argument that was made in favor of the proposition, and it certainly fits with my observation of how at least some schools have reacted or related to the accreditation process, and seeing the accreditation process as a kind of straitjacket that they have to fit within that, and if they put a toenail out of line, then it's going to be chalked off. So I'd like to hear a bit more from Elizabeth about. I mean, you're arguing for this. Maybe you don't believe in it anyway, but you know, how that works, and how maybe we can look to the accrediting bodies to demonstrate that they actually do or could support innovation.
I'm very happy to speak about that because I do believe to some extent from personal experience. Now, the thing that I would share is in my current position, I'm a founding dean. And before I took this position, I was certainly involved in accreditation on both sides. You know, I wrote self-studies, I was on self-study committees, I did site visits, etc. But I didn't have the same relationship to accreditation in that role as I do now in this role. So before I could recruit my first student, before I could publish my first brochure, before I could put up a website, I had to meet standards of accreditation that changed during the process all along the way. I have to do about every 2 years a full self-study, a full site visit. I have to do annual in-depth reports. I have another special focused site visit coming up in the future. So I've lived a very different experience as a founding dean. And I've also had the luxury of being part of a health sciences university that's very, very interprofessional, very, very collaborative. And I've watched what other programs have gone through. And there's one particular college on my campus that's extremely innovative. They've done a lot of different things. They've embraced a true problem-based learning curriculum. They've adopted a disseminated clinical education program. They've adopted a research agenda that emphasizes educational research as a different model. They've been innovative all day, every day from day one. And it's been a nonstop, ongoing tension and difficulty with their accrediting agency. And so I've witnessed that. And having a very high stakes game where I live and die by the accreditation process, I cannot put one toe out of line. And I feel that way, that when people on my faculty members or administrators or what have you approach me with great ideas, innovative, I often am inclined to say, no, not yet. Because we are not ready with our stage of development and our very close scrutiny and our very rigorous ongoing assessment, we can't innovate just yet. So that's really part of my experience and why I've come to this position. And it is different being at a new institution versus a well-established institution.
We've got now 2 minutes for responses. If you want to add some more, Elizabeth, since you're on a roll, if you want to continue with to indicate whether or not you agreed with your position or not, or make any additional comment.
I think I've said it all. I am not anti-accreditation in general. I do believe that the going through the accreditation process does add value. It does give us structure. We always benefit from going through the process. However, where I deviate is the concept of innovation. I don't think it's the accreditor's job to support innovation. I don't think that's what they're all about. And so that is where I would disagree in the proposition of saying, you know what, because it's not their job, because that's not what they're all about, and because I've lived a very rigorous experience and seen what happens potentially, is why I feel the way that I feel.
Karen?
When we started planning for this debate, I wanted the other side. It's the intellectually more interesting side. In fact, she's working for my notes. However, I have to say that having looked at this, I would disagree. I would say that it is the role of accreditation not to block or hinder innovation. And in fact, there are times when it's appropriately in terms of social accountability to support, I think, the direction of educational programs in health professions, particularly as we deal with it as a society, as a country, as a nation, or the world at this point in time. And so I think that what's important that we, as we move forward with accreditation, that as I mentioned, that how important it is to have flexibility in our standards, how important it is to start to encourage accreditors to have conversations that support common language and common standards and perhaps some common competencies. I mean, some of what we do is highly repetitive across the health professions in ways that are not necessarily helpful and bring us together. And essentially, I think the challenge is to move from the notion of standards to look at some of the outcomes and think about how the rubber hits the road, so to speak, in terms of actually implementation and a better assessment of how we ensure that the competencies can be cross-cutting and meaningful, and I think attest the accountability that accreditation is to serve.
One more thanks to our debaters for their presentations.